But before I talk about the July issue, I wanted to talk to you a little bit about my personal experience here in what has now become one of the epicenters of the COVID pandemic. So uh, here in Arizona, we were feeling very lucky during March and April and May because we had COVIDs, but our university hospital had one ward open, maybe sometimes two, and things were just rolling along, no trouble, and we were taking care of the patients, even though we often weren't sure what we were doing, but getting smarter as we went along. And then suddenly in June, we accelerated, and I think as most people have heard over the national news media and so forth, Arizona is now one of the hottest areas in the world in terms of number of cases per population and mortality rate and so forth. We don't quite understand this. We were hoping that the fact that we're spread out, that we're warm and dry, was somehow going to protect us from the COVID, and that, of course, turned out to be completely wrong. We have not had quite the disastrous experience that New York and New Orleans had, where we couldn't even get patients into the hospital. There were so many. We've been able to keep up, but just barely keeping up. Phoenix area has been worse than the Tucson area, but we still have 1 million people here, and there were lots of cases. The hospitals were really loaded down. Of our hospital population, 1/3 were COVID patients. We had 4 wards open, still have 4 wards open, but it looks like the peak has passed. This disease is no joke. The naysayers who say, oh, it's all a hoax, they're the hoax, because I can tell you people are suffering and dying every day. It is absolutely no joke. And what we're beginning to see now is we're seeing folks come back who were discharged from the hospital, got so-called better, went home, and a month later come back with complications. So there are late complications from this COVID too. And I think we're going to be seeing a lot of problems, just like post-polio in the days when there were polio epidemics. We saw patients coming back with problems later. Indeed, the English have already established a number of COVID rehab hospitals for these late complications that are occurring. Things like deep venous thrombosis, pulmonary embolism, strokes, and of course, regular pneumonias. So, I mean, there's going to be a large population of people who are going to be significantly disabled from this. And so we're going to have a whole new group of patients to take care of, even when the pandemic quiets down. Hopefully, when we have a vaccination that's widespread, and like the flu, we have it more or less under control.